There's probably nothing that strikes fear into a patient's heart more than the sound of root canal treatment. It's really the gold standard, I guess, of what patients want to avoid in dentistry. But what we found is most of our patients experience a painless root canal treatment. They finish at the end and go, what was I worried about? I'm surprised I'd heard all those stories. And what we find is essentially if we control the infection first, and sometimes that needs some antibiotics, if we give enough anaesthetic so the patient is totally numb, we can get through more than 95 of our root canal treatment procedures, and they're less complicated than a filling for the patients. They don't feel it, they don't have the discomfort during the procedure, and even afterwards with the technology that we're using, the post-operative discomfort is fairly minimal. So it's one of those things that used to be something that people talked about and had really negative experiences. And because I've invested in the technology, we can do it in a way that makes it very comfortable for patients, in a way that looks after them. It doesn't have to be a procedure that people are worried about anymore. Yeah, root canal treatments are often needed if patients have had decay that has gone all the way to the nerve, or if the tooth's been traumatized and the nerve has died. And sometimes just fillings have become bigger and bigger, or there's decay underneath the filling, and it's our way to keep the tooth. So the alternative really is extracting the tooth. And I know as a dentist, it's the last thing I'd want to have a tooth removed.